How Acretin 1.2% Clindamycin Tretinoin works. Acretin 1.2% Clindamycin Tretinoin is a combination of two medications that treat acne. Clindamycin is a lincosamide antibiotic that kills acne-causing bacteria on the skin. Tretinoin is a retinoic acid derivative, which is related to vitamin A. It promotes healthy skin growth and lowers the amount of oil on your skin. What is Acretin 1.2% Clindamycin Tretinoin used for? Acne and can be used for adults and children over 12 years old. How to use. Use a pea-sized amount of Acretin 1.2% Clindamycin Tretinoin. Gently rub it over the entire face once a day at bedtime. Do not apply it to the eyes, lips, or inside of the nose. Clindamycin Tretinoin can take up to 12 weeks to work. During the first few weeks, you may notice that your acne gets worse. This is expected and happens because the medication is working on pimples forming underneath the skin. Don't be discouraged if you don't notice improvement right away. Continue to use this medication exactly as prescribed by your healthcare provider. Warnings and precautions. Contact your doctor immediately if you experience any of the following: allergic reactions, severe diarrhea. Caution small. The following side effects may get better over time as your body gets used to the medication. Let your doctor know immediately if you continue to experience these symptoms or if they worsen over time. Common side effects: skin redness 26–35%. Scaly skin 13–17%. Itchy skin 4–10%.